Well, good morning, everybody. Thank you for joining our webinar today. I'm Dan Leonard, President of the National Pharmaceutical Council, and we appreciate you giving us some time this morning to go over this survey and to participate in our webinar. This is the third year that we have conducted this survey that we're going to share the results with you of today. And when we first conducted the survey on comparative effectiveness research, this landscape survey, which was in 2010, the first time we did it, the healthcare environment was very different than it is today. If you think back, you'll recall that the Affordable Care Act had just been signed into law. The Patient-Centered Outcomes Research Institute Board of Governors had just been appointed. I don't believe they had even had their first meeting officially, but they were just in the process of being appointed and being set up. And essentially everything else about the healthcare law was still up in the air at that point. And CER, in and of itself, was also a very new proposition in the United States. There had been more activity around CER in Europe and abroad than here in the States, but it's still a new proposition here. And there were many more questions about it than there were answers. So now, fast forward 3 years to our most recent survey, which was conducted toward the end of 2012. Not long before we went into the field, the Supreme Court decided to uphold the Affordable Care Act. PCORI, the Patient-Centered Outcomes Research Institute, had developed its research priorities and methods, and the government, the federal government and the states were moving full steam ahead at this point on health exchanges and implementing other parts of the law, the new law, the Affordable Care Act. So given these changes in the environment, it's not surprising that stakeholders, the stakeholders that were interviewed for this survey, their views of CER have also changed. There are a few surprises in the survey that you will see, the results that we'll dive into in a few minutes. But every year the survey becomes more, I think, more interesting as we see movement from what was the baseline just a couple of short years ago. And in general, we believe it's very informative now that we have 3 years of history, 3 years of data, tracking trends in the area, and we look forward to keeping our finger on the pulse of CER here in the U.S. So right now we're going to jump right into it. I'm going to introduce the other voices that you'll hear on this webinar. First, Kimberly Westrich is the Director of Health Services Research at the National Pharmaceutical Council. For the last 3 years, she has been our lead on this survey project, which was conducted with Social and Scientific Systems Incorporated. Claudia Schur from SSS is also on the call, and if there are any questions around the methodology and of the survey itself, Claudia can jump in. But Kimberly is going to deliver the meat of the presentation, and following Kimberly's review, we'll hear from two special guests who are also on the call today as reactors to what we share. Dr. Lisa Simpson is the President and CEO of AcademyHealth. She'll be providing us with the viewpoint of the academic research community. And Dr. Joe Selby, Executive Director of the Patient-Centered Outcomes Research Institute, is also on the call and will give his perspective on the survey as well, on the results. And then following Joe and Lisa, we'll open it up for questions from those of you on the call. Right now, we're going to turn it over to Kimberly Westrich.
Thank you so much, Dan. And thank you, everyone, for joining us today. As Dan mentioned, in the past few years, there's been an increasing focus on the value that comparative effectiveness research can bring to healthcare decision-making. So in 2010, NPC worked with Social and Scientific Systems to develop a survey of healthcare decision-makers and the environment for comparative effectiveness research and decision-making. And I'd like to give a special shout out to Claudia Schur and Annalise Adams at SSS, who have been wonderful partners on this endeavor. So we've now fielded this survey annually for the past 3 years, which enables us to see how opinions have changed and evolved over that time. This year we had 114 respondents complete the survey. This is similar to the prior years, and the stakeholder distribution is similar as well. The largest categories of respondents were researchers and thought leaders, insurers and health plans, and business coalitions and human resource consultants. We sent the surveys out by email and FedEx. We used phone follow-up and multiple contacts to encourage survey response, and we also had an option for charitable donation to encourage survey response. So what did we learn this year? These first charts will display results from all 3 surveys. The baseline survey is in the dark blue, and the most recent surveys in light blue. What we see is respondents are reporting that CER is still important to them, but fewer people are saying that it's very important. As Dan indicated, when we began this survey, PCORI was newly established, and CER was getting a lot of attention as the solution to improving quality and slowing cost growth. Some of that excitement seems to be slowing down a little bit, as we can see in this slide. We've also seen an increase in the familiarity with PCORI and its mission over the 3 years. The next 4 slides are very similar in format. Each one will focus on a task that is related to comparative effectiveness research and which group stakeholders think will play the most significant role in accomplishing that task over the next 5 years. You'll see the stakeholder groups across the bottom. These will be the same groups in the next 4 slides. This particular slide focuses on establishing research standards. Here we see that stakeholders think that PCORI and AHRQ will play the most significant role in establishing research standards. This second slide focuses on establishing research priorities. In this area, stakeholders are looking to PCORI, NIH, and AHRQ to play a significant role in establishing research priorities. The third slide pertains to funding and monitoring research. In this area, stakeholders are looking to NIH and to the pharmaceutical and medical products industry, followed by PCORI and AHRQ. Something interesting that we see in this area of funding and monitoring research is that FDA is starting to show up a little more often on stakeholders' radar. The last slide in this series focuses on conducting research. Here we see that stakeholders think that academia and the pharmaceutical and medical products industry are expected to play the most significant role in conducting research. However, we're also seeing that private health plans, PCORI, and the FDA are all having a growing presence in this area. Stakeholders were asked about the impact of comparative effectiveness research on healthcare decision-making for 4 different time periods. Over the past year, that's the top bar on the slide, the upcoming year, 3 years out, and 5 years out. The darker green the bar is, the more impact stakeholders expect comparative effectiveness research to have on healthcare decision-making. You can see that they believe that there's been little impact over the past year. They're slightly optimistic about the upcoming year, and much more optimistic about the longer-term horizons of 3 and 5 years. So the impact of comparative effectiveness research on healthcare decision-making is still very much a horizon issue for our stakeholders. In the final set of slides, I'm going to walk you through 9 issues. You can see the 9 issues on this slide, but don't try to read them yet. We will go through them one by one. Each issue has a left and a right anchor, and the right anchor represents a more favorable environment for patients. For each issue, we ask stakeholders to pick a number from 1 to 7 to represent where they thought the current environment is. And so if you look at the top line, you can see that the left anchor is represented by 1, the right anchor is represented by 7, and 4 is the midpoint. So on the following slides that I'll be walking you through, what we're summarizing is the negative responses. Those are people who responded 1 or 2 towards the left end anchor, And then the positive responses are the people who responded 6 or 7. That's the positive right side anchor. The first issue that people were asked about was the availability of new research methods. The left anchor here, or the negative response, is extremely limited research methods. The right anchor, or positive response, is readily available research methods. For all of these slides, the darker blue will represent the negative, or the left anchor responses, and the light blue represents the positive, or the right anchor responses. What we see when we look at this slide is some general progress over the years. There's decreasing darker blue bars and increasing lighter blue bars as we look from the left to the right among the bar pairs, moving from 3 years ago to today. We also see that there's been a little bit of slippage in opinion in this most recent year of the survey. The second issue is the availability of agreed upon research standards. The left anchor, or negative viewpoint, is no standards. The right anchor, positive viewpoint, is widely agreed upon standards. What we see with respect to this issue is a recognition that we've moved away from having no standards, but we still have a long way to go to get to the widely agreed upon harmonized standards. The third issue is research priorities adequately addressing the treatment choices that are faced by patients and providers. The left anchor is that the research priorities do not adequately address the treatment choices. The right anchor is that they do adequately address the treatment choices. We see here that stakeholders have some concerns about the degree to which research priorities adequately address treatment choices. For this particular question, we did a crosstab with the earlier question about the groups that played a significant role in establishing the research priorities, and we found that the people who thought PCORI would play a significant role in establishing those priorities were significantly more likely to feel positively about the adequacy of treatment priorities when responding to this question. The fourth issue has to do with the use of objective and transparent processes for interpreting evidence. The left anchor is not at all transparent and objective. The right anchor is fully transparent and objective. On this slide, we see a very similar pattern to the very first slide in this series on research methods. There's been general progress over years in terms of reduced negative responses and increased positive ones, but there's been just a bit of slippage in this past year. The fifth issue has to do with the predictability of adoption and diffusion of medical treatments and technologies. The left anchor, not at all predictable, and the right anchor, highly predictable. And here we see some nice progress in the first year and kind of some general inertia after that first year. The sixth issue is the exchange of medical evidence across payers, providers, industries, and agencies. The left anchor is varying standards and limitations, and the right anchor is consistent and transparent standards. Here we see that there are fewer negative responses, but we're still a long way away from achieving consistent and transparent standards. The seventh issue has to do with the consideration of quality, outcomes, and value when making treatment assessments. The left anchor has to do with considering only clinical effectiveness. The right anchor is taking a broad focus for all of these factors when making treatment assessments. And here we see very limited progress, although the positive responses do grow a bit, and it's enough to achieve significance when compared to the outlook 3 years ago. The eighth issue has to do with how healthcare services purchasing decisions are made. The left anchor is taking an individual or a siloed view of services. The right anchor has to do with taking an integrated view of services. And on this slide, we see a very definite recognition of the movement away from silos and toward integration. And I think this is probably not surprising in our brave new world of accountable care organizations. The final issue has to do with the extent of outcomes-based contracting. The left anchor is little to none. The right anchor is widespread. And here we can see that outcomes-based contracting is viewed as a little more common, but still far from prevalent. And now I'd like to turn it back over to Dan to introduce our panelists.
Okay, thank you, Kimberly. I think that it'll be very interesting and enlightening for folks to hear from our two guests who have joined us on the line today as well. We have two panelists with us, and we're going to get a few minutes from them on their insights and their response to what they've seen. First, I'd like to call on Dr. Lisa Simpson, who is the President and CEO of AcademyHealth, to share her thoughts representing the perspective of the academic research community. Lisa, thank you for joining us. Go ahead.
Dan, hi. Thanks so much. Can you hear me okay? I just want to check on my feed.
Yep. Ideal.
Great. Wonderful. Well, first I'd like to thank the National Pharmaceutical Council for conducting this survey over the last 3 years. I think it provides important and timely information about all of our interests in the field of comparative effectiveness research. And as you mentioned, I'm speaking from the perspective of the academic community. AcademyHealth has many of those as our members. We are the professional society for health services research and have over 4,600 individual members and organizational affiliates. So I think that this is particularly intriguing findings over the last 3 years because of of who you've sampled and the good representation, especially that you have from purchasers across the employer, business coalition, and health plan community. Obviously, you've also included researchers and thought leaders. But I would be interested to see the results pulled out, particularly for patient groups and physician groups. I think that since clinicians and patients are a prime audience for the findings of comparative effectiveness research, I think understanding how they view this will also be important. So as I reflect on the findings, I'd like to point out several or focus on several key items. I think the first one to point to react to Kimberly's initial findings around the importance of CER to the stakeholder groups, going from, still very important, but going from very to somewhat less important. I think that we're seeing that we're getting into a bit more of a reality base, going from the abstract promise of the potential of comparative effectiveness research to the reality of what it takes to actually do research and the time it takes and the rigor required to really come up with robust findings that are solid upon which to base our decisions. But I think at the same time we see that same sort of reality check reflected in slide 11 that Kimberly showed, where there is increasing confidence that decision-making will be informed by CER, with that number percentage saying we'll see moderate improvement going up to 55% in 5 years. So I think that that's sort of a nice grounding in the reality of research. The second point I want to make is around the findings about research standards and priorities. So first of all, this has been a very important dimension of PCORI's work since it started, but certainly it builds on longstanding work by AHRQ in both of these areas. And I'm not surprised to see some of the findings around lack of awareness or for the standards, as they are recent. And there's a lot of work that needs to be done amongst the academic community to understand and adopt those standards. And so one of the things that I know that we're delighted to be partnering with PCORI on is a mini course this summer in Baltimore as an adjunct to our annual research meeting around the methodology committee report around method standards. The second point I want to make is around who is doing CER. And as Kimberly said, we see the continued dominance of academia in the conduct of CER, not surprisingly. But I want to highlight the growth in the other sites of health services research in CER, particularly noting the health plan growth. And this is, I think, reflects what we're also seeing in the careers of our members. AcademyHealth convenes the Health Services Research Learning Consortium, which is a group of training directors and employers, because we are seeing a lot more diversification in the host organizations for CER. And so we're excited about that, and I think this survey reflects that reality. And the final point I want to make about the response that 22% still say that method standards are extremely limited, I think that finding really reinforces the importance of PCORI making infrastructure and methods a priority in their agenda, and how much the PCORI PFA, how important that will be to help really expand the methods that are available for CER and the data infrastructure for it. And this is an area where the field is really innovating and working hard to figure out how to use electronic health record data and its multiple formulations, and how to apply rigorous methods to EHR and personal health record and other types of data to generate comparative effectiveness research. The final point I would make on that issue of the rigorous methods is not only do we need the methods, but we need the training of the workforce on how to apply the methods. And here again, look forward to seeing what ends up continuing to be funded in terms of the training support from the PCOR Trust Fund to AHRQ in training the workforce to apply these methods. So with that, I think I will stop now and turn it over to Dr. Selby.
Good.
Yeah, thank you, Lisa. Go ahead, Joe.
Thanks. And Dan, I want to just check and make sure you can hear me as well.
Yeah, absolutely. You sound great.
Outstanding. Good. Well, I want to add my thanks to Lisa's, to the National Pharmaceutical Council for your ongoing, steadfast interest in and support of comparative effectiveness research, and for the conduct of this really very interesting survey. Surveys are intriguing in one sense because one can look at the results and wonder what was really in the minds of the respondents, and consequently interpret them in a variety of ways. You know, we're to some extent, the sample size of 114 makes us a little bit even less certain of what we're seeing. But having said that, I really agree with Lisa that these results do make sense. Comparative effectiveness research, the way we see it at PCORI, with its emphasis on conducting studies in real-world patient populations and settings, with its emphasis on looking at multiple outcomes, with its emphasis on rigorous methods and on looking for possible differences in treatment effects across patient subgroups. All of that just makes a world of sense. And I'm reminded of my executive director back at the Permanente Medical Group in California, when I asked him about 7 or 8 years ago if we oughtn't to start evaluating the electronic health record as it was being implemented. He said, it's way too early to evaluate. And, you know, in some sense, I think people in this survey are suggesting that too, that you need to be careful in these early years. So I would agree with Lisa completely about that slide from its comparative effectiveness research is very important to my organization, down to the very same proportion now say it's somewhat important. Nobody says it's not important, but I think that's an adjustment. There was a real romance with CER when it was first articulated. I don't mean to say that it was first done because CER has been being conducted for a long time. But, the notions that I just laid out had a lot of cachet 3 years ago, around the time that the Affordable Care Act was implemented. And it doesn't surprise me that people were exuberant then, and then as they began thinking about it more, keeping in mind that many of these were the same respondents year after year. Doesn't surprise me that they put it more in perspective. I'm gratified to see that they increasingly appreciate PCORI's presence and its role as a funder, among others. I'm also really gratified that they recognize the importance of other funders in this arena, NIH included, and even a nod toward FDA. As I said, I think CER is a kind of research that is just so good, such a good set of ideas on its face, that it would be a tragedy to think that it was confined to the mandate of just one institution out of all research institutions. So I think that's very accurate, and I hope that they prove to be right, that funding comes from all of these sources. I'll echo what Lisa said about the growing expectation of these respondents that there are going to be multiple and some new players conducting this research. And particularly, again, as Lisa pointed out, the importance of healthcare systems in specifying the research that needs to be done and then in participating in the conduct of that research can't be overstated. We put a lot of emphasis at PCORI on getting the questions from the stakeholders, but there's also a role for the stakeholders to do more than just ask the questions. They've got the data in many cases. They've got the data collectors. They have the patient populations and the real-world settings. So really endorse the survey respondents' hopes that healthcare systems get more involved in conducting the research. I think the expectations, the slide that suggests that it's going to take 3 to 5 years before CER really starts having an impact, are very consistent with what we and AcademyHealth and many others in AHRQ say about comparative effectiveness research, that if it's going to make a difference, it's going to have to use rigorous methods. It's going to have to look at critical outcomes. It can't settle for more easy short-term intermediate outcomes necessarily. And it's going to have to look for these subgroup differences. That takes larger patient populations, and it actually, if anything, takes a bit more time. So the notion that it's going to take 3 to 5 years before CER that started this year has a big impact is just realistic. I was pleased to see that in terms of standards being available in slide 14, there is a decline in the proportion saying that there are no standards available, but there is no decline yet in saying that standards are widely agreed upon. And I think that PCORI's methodology committee would be pleased to know that there was a 10% decline in people saying there were no standards available since PCORI's methodology standards came out in November. But I think they completely agree that they're not widely agreed upon yet, and they'd also agree that there's room for refinement and expansion of these standards. And the workshop that Lisa mentioned at AcademyHealth in June is one clear example of work that the methodology committee wants to participate in to engage the research community and the user community and come to greater agreement on the standards. And just in closing, the notion that purchasing is becoming more integrated, that is, as Kim suggested, probably more a consequence of changes in the way that the Affordable Care Act reimburses, and happy to see purchasing moving in a more integrated direction. And I think that as it does, the demand for good comparative effectiveness research evidence will only, the need for it will be appreciated and the demand will grow. So I'll close and and look forward to some discussion. Thanks.
Great. Thank you so much, Joe. Just a note before we get into Q&A, because we've already had this question a couple of times about the slides. And all of the materials from today's webinar are already available on our website, including the slides. So if you go to our website, www.npcnow.org/CER Survey 2013. So if you go to our website and then add the /CER Survey 2013, you should find all of the material, including the slides. We're getting some questions in. If you can bring them in via live meeting or through Twitter, we will ask them. But I'll start with one to you, Joe. So PCORI's first round of studies are in the field or have recently been funded and put into the field. Two-part question. When do you expect the first results from some of those early studies to come in? And would you anticipate that that once these surveys and once your studies start coming in, that's the kind of thing that can have an impact on the stakeholders and a survey such as this? And how will you communicate the communication, dissemination of your work, because that's going to be really key to moving the needle.
Thanks. Well, these first projects, nearly all of them, Dan, are 3-year projects. However, we are planning what we call a very active portfolio management set of activities, which means that we will be keeping a very close eye on working with the funded investigators so that we identify early learnings, so that we identify findings that may be worthy of dissemination as early as possible, and either work with stakeholders when that's feasible to disseminate, or possibly add funding for a dissemination activity or an implementation activity. So we aim and are anxious to see the impact of this research and to cut down the time it takes to go from publishing findings to getting it implemented. We'd like to speed that process as much as possible. The only other thing to be said, the other thing to be said is that in terms of dissemination, as you know, AHRQ is funded through the PCORI, the PCOR Trust Fund to work with us on dissemination. So we anticipate that we will indeed collaborate with AHRQ on dissemination activities related to these findings. And a big question for the Board of Governors now is what, in addition, we'll do with respect to dissemination. But it looks to me as though we will be very inclined to be supportive of specific dissemination and implementation activities. So our aim is to get these findings, when they're appropriate, out and to change practice as soon as possible.
Great. And one for you, Lisa, before we go to the folks on the webinar, specific to methods. And there's been a lot of work, particularly from your members, in the area of methods and trying to construct more standardized methodology. Do you think we've made progress in the last 3 years in that area? And are there more new methods and more standard approaches being practiced and put into use now?
Thanks, Dan. Yes, I think we're making progress, particularly in the area of the application of the newer methods for studying large data sets and accounting for issues of sampling, not having controlled samples, and so the use of observational data. But I think that where we still need to have continued emphasis is related to, as I said earlier, to the methods to use in using electronic health records for CER. And here I would mention that one of the things about methods advances is that when you read journals, regular peer-reviewed journals, I'll paraphrase what one of our senior program directors here says, is that most articles report on the destination of the research. In other words, what were the findings? And the methods section is pretty small. And at a time like today, when so much innovation and adaptation and testing is happening to develop better methods. What we really need is much more detail about the journey, how people got to the research design and methods and analyses that they did. And so in recognition of that, one of our projects that's led by Dr. Aaron Holvey, the Electronic Data Methods Forum, actually launched a new online open access peer-reviewed journal called eGEM. And you can find that on the web, but it's very much to talk about what people are actually doing in terms of both data and methods to use these new sources of information. So I think we're going to see a lot of innovation in this space, and I think that as people become more familiar with the standards from PCORI and these methods, then we're going to start doing more, application of more consistent standards. But I think we're going through a stage of innovation where we're going to see lots of different things emerging.
Very good. So now we'll move to the questions that are coming in via the live meeting and Twitter. And this is one that that struck us too when we saw this survey for the first time. Joe, will direct this one to you. Is that the trend clearly is the influence, importance, if you will, of PCORI has been on the rise. And in this year particularly, we saw a drop-off in influence, if you will, of both AHRQ and NIH. What do you attribute the decline in relative influence of AHRQ to, Joe? Do you see a less active, influential AHRQ as being an impediment to PCORI's broader mandate? You want to tackle that one, Joe?
Well, we certainly don't want a less active, less influential AHRQ. They've been pioneers in the area of comparative effectiveness research and advancing the methods as well as conducting the research. So we hope that continues. I have to think that, let me just get to this slide again. Again, this is some of the vagaries of responses to a survey when you can't go any deeper. But my hunch is that this decline is probably just something that feels good cognitively to somebody who's saying that PCORI's influence is going up. I just repeat that.
And Joe, if I could jump in.
Continues to play the role that it has. Go ahead, Lisa.
Well, I was just going to say that let's look at the fact that AHRQ funds not just and has been funding comparative effectiveness research, but it funds it is the lead agency for health services research. So there's much more to health services research than CER. That's just one component. And if you look at the relative budgets that each agency has for CER, PCORI will have many more resources dedicated to CER. And so I think it's also a reflection of the recognition of just the size of the PCORI budget for CER compared to what AHRQ has. Because AHRQ is certainly seen as very much a leadership organization for the field as a whole.
Yeah, I think that focus on the relative budgets is very likely contributing to this, although that doesn't explain the decline in NIH, which I most certainly hope doesn't come to pass.
I would, yes, agree with you. NIH is a critical funder here.
Yeah, we've gotten that slide up on the screen so people can look at it while you were talking, because I think it is illustrative of what you were just speaking to. We had another question coming in from Twitter, if I can jump to that. And I think we'd like to hear from both of you on this, but Lisa, maybe you could start. The exchange of medical evidence across different platforms, across payers, providers, industries, and agencies is still not consistent and transparent. Are there solutions, are there activities going on now where that will lead us to a more transparent exchange of evidence?
I hope so. I think that this is a critical part of creating transparency for clinicians and for patients, especially as they become more informed and activated and engaged in shared decision-making for their care. I think that a couple of comments. One is that, again, let's think about who the respondents to this survey are. And I think it did not include a whole lot of patients and clinician groups, as far as I know. So that may be part of the reason for these findings. And could you tell me again the slide number for that particular finding so I can be looking at it? I'm not online. Okay. While you're finding that out,
we're gonna investigate that.
Okay, thank you. The other point I would make about transparency and availability and exchange of evidence is a couple things. One is the challenge of translating evidence into decision-making, evidence into action is a long-standing one for the entire field of research, not just CER. And so that's, it's part of the reason that the NIH established a translational research map, that we have the CTFA. It's why AcademyHealth has launched a new Translation and Dissemination Institute. I think that this is one of our enduring challenges as a research enterprise, is how do we actually capitalize on research findings and get them into practice quickly. So I think that it reflects that. The other point I would make is that as the health insurance exchanges go live next year at the state level or through partnership exchanges or federally facilitated exchanges, again, I think we're moving towards more transparency on the essential benefits package and various other approaches for transparency for consumers and clinicians. So I'm hopeful that we'll see progress over the coming years.
Well, we do have that slide up, Lisa and Joe. I don't know if you have a comment about this on evidence exchange.
Well, I'm glad to see the negatives going down. That provides some hope. I think this is a vision that people who talk about our country becoming a learning healthcare system, can't escape. It's a vision that I find here in Washington. Everyone sees the potential that would accrue to our entire population if we could more frequently and more transparently both generate and share evidence. A number of federal agencies have made efforts in this direction to build research networks, to support research networks. PCORI has expressed a lot of interest in this area. I'll repeat what I said before, that to the extent that the healthcare systems that manage this information, the data, and really have the questions, to the extent that they can be more engaged in the prioritization of the questions and the conduct of the research, I think our chances go up that the exchange of this evidence will be quicker and feel more transparent. But just to say that I'm glad the negatives are going down, and it is a vision that's worth pursuing and investing in.
Great. And we have another question that's come in via the live meeting. And Joe, I think this one is most appropriately directed at you. The question is, the survey indicates that AHRQ and PCORI will both be viewed to be responsible for establishing research standards and priorities. What is the role of each entity in this, and how will collaboration be facilitated, and how will we ensure there is not overlap between the two organizations?
Well, first of all, I think we have the overlap covered or protected against quite well in the person of Carolyn Clancy presently on our Board of Governors, and Jean Slutsky, the head of the Effective Healthcare Program, on our Methodology Committee. So I think that the chance that we'll duplicate or be redundant are very slim or non-existent. Through the Effective Healthcare Program and the DECIDE Network and its Method Center, I think we can anticipate that AHRQ will continue developing methods and in the process setting standards. And I think that our Methodology Committee certainly has an important role to play there, and it collaborates closely with AHRQ in that effort.
I'll throw one in here. clearly we still see that folks believe this is a horizon issue for the most part. They're more optimistic in the out years that we'll see progress and actual improvement in medical decision making in the out years. But as we move along, we're now in year 3. So as we get into year 4 and 5, before we start seeing significant research coming in from PCORI and other sources, do we run the risk, or is there a risk, Joe, I'll direct this to you first, of people's patience running thin in this area? That must be something that you consider on a fairly regular basis.
Well, I'll go back to what my CEO at the Permanente Medical Group said. Considering that the need for this kind of information is so apparent and becomes much more apparent as we really move toward trying to make rational decisions, trying to integrate our activities at improving quality and right on down to purchasing. I think the need for this kind of real-world evidence is only going to increase. I think working on the standards and working on methods as well as conducting the research is going to keep it in the forefront of people's minds, engaging the end users of this research in prioritizing the questions. In our view, it goes a long way to keeping them at the table while the research is being conducted. So I'm not concerned at all that somehow we're going to lose enthusiasm for CER any more than we've begun to think that, well, maybe we should really go back to the paper medical record. I don't see it happening.
Lisa, do you have any thoughts on that? Specifically, how if the patients, if you will, not medical patients, but the patients of the stakeholders that we're interviewing might run thin if they don't see real decision making and real change in the marketplace within the next couple of years. Do you see that or not?
Well, I think the answer is yes, and it depends. And the answer is yes for certain stakeholders. And here I would separate out the stakeholders that I think are largely represented in your survey, the business community, the payers and purchasers, from the stakeholders, the broader stakeholder community, and particularly those who ultimately are paying for this research through taxpayer dollars, whether those dollars come from health plan fees or general appropriations. So I think that the reality of healthcare costs cannot be sort of made small. It is such a huge challenge for our field and for our healthcare system that we are putting a lot of expectations on comparative effectiveness research to help make better choices and eventually help patients understand that more is not always better. I think that the emergence of the Choosing Wisely campaign and other efforts to try to really educate the general public about the importance of using evidence in making choices about your care as an individual is critical. And then I would also say that the reality of the federal fiscal situation cannot, again, be downplayed, and there is impatience. And I think that the federal agencies and PCORI are very aware of that and are working hard to deliver early wins and results to really show that this is a worthy investment and must be continued. But I think it's incumbent upon us to really listen to that need because it's very real.
And Lisa, this is also to you, a tweet that's come in just it's asking, would you please repeat the name of the Open Journal on Electronic Data Research that you mentioned earlier?
Sure. It's eGEMS, G-E-M-S. And if you just Google AcademyHealth and eGEMS or EDM for Electronic Data Methods, EDM Forum, you'll find it. don't have, and we can send a specific URL for folks if interested. So it's eGEMS, GEMS.
Great. And Kimberly actually has a point on exchange of evidence based on one of the earlier questions.
Sure. A point that I wanted to make when it comes to exchanging CER evidence among stakeholders is that there's a couple of areas that could be improved to help us make some headway in this area. The first issue is that the pharmaceutical industry in particular has a lot of limitations around who it can talk to and what it can say and how. And then when you look at anyone other than the pharmaceutical industry, there's actually not a lot of standards around what can be said and how. So it would be helpful to actually have some standards in place to help assure that anyone that's communicating CER evidence is communicating it in an accurate and a useful way. So that's one thing that would be helpful, standards for everyone so that we could all be confident in the information that's being used and shared and the accuracy and the usability of it. And it would also be helpful for the pharmaceutical industry to have a little bit more guidance and clarity around what it can say when.
Great. Well, I think that gets us pretty close to the appointed hour here for our webinar, and I see no more questions coming in on Twitter. So what we're going to do is close this out and thank our guests, Dr. Lisa Simpson and Dr. Joe Selby, for joining us on the webinar and for providing their very insightful insights and thoughtful commentary. Also, thanks here to Kimberly Westrich and also to our colleagues at SSS for conducting the survey in year 3, and we will no doubt do it again and have a similar program a year from now. But also thank you to everyone online for participating in the webinar. As mentioned earlier, all of the materials that have been presented today will be available on our website at www.npcnow.org/CER Survey 2013. So you can go there and get these slides going forward. So again, thank you everybody, and we'll sign off.
Thanks, Dan.
Thank you, Joe.